Hi, I'm Dr. Lara Barbir. I'm a clinical psychologist, author, and educator, and I specialize in trauma, depression, and perinatal mental health. Today, I want to share 5 things that everyone should know about postpartum depression, because this topic is still widely misunderstood, and that misunderstanding keeps too many people suffering in silence. Here's the first thing. Postpartum depression affects people of all genders, not just women. Postpartum depression is often framed as something that only affects mothers, but that's simply not true. It can affect fathers, non-gestational parents, and caregivers of all genders, with the research showing that 1 in 7 women and 1 in 10 fathers have postpartum depression in the first year. I've worked with many parents who didn't recognize their symptoms because they didn't see themselves represented in the conversation. That sort of invisibility increases shame and then delays help. And the longer someone waits, often the harder that recovery can feel. Here's the second thing. Postpartum depression is not a personal failure. It's a nervous system under strain. Postpartum depression is not a sign that someone is weak, ungrateful, or failing at parenthood. It's often the result of a nervous system that's overwhelmed by a complex combination of hormonal shifts, sleep deprivation, trauma history that's getting subconsciously activated, relationship stress, and unrealistic expectations about what new parents are supposed to feel like. Here's the third thing. Understanding why you feel this way is not quite the same as healing. Many parents can clearly explain why they're struggling. They've read books, listened to podcasts, and done their own sort of research. But that kind of intellectual insight alone doesn't lead to relief. Healing requires emotional and physiological integration, experiences that help the nervous system feel safer and more supported, and not just more informed. This is why trauma-informed and nervous system-based approaches are so important. Here's the fourth thing. Struggles with bonding are common, and repair is absolutely possible. Postpartum depression can temporarily interfere with emotional connection or bonding with the baby. That, of course, can be incredibly distressing, but it does not mean attachment is broken or permanently damaged. With the right support, bonding can be repaired and even strengthened when the parent is focused on attachment reorganization. What matters most is responsiveness over time, not perfection in the early weeks or months. And here's the fifth thing. Prevention is possible, and we do not talk about prevention enough. One of the most hopeful things that I've learned is that postpartum depression isn't just something we react to. It's something we can often reduce the risk of. Supporting emotional regulation, realistic expectations, and relational support before and during the transition to parenthood can make a meaningful difference. And not just for the new parents themselves, but for their children and for generations to come. When we care for parents' nervous systems in this way, we're also then caring for the next generation. If you or someone you love is struggling, please know that help is available and that healing is possible. You can find more of my work and resources at drlarabarbir.com, and I also share educational content on LinkedIn and YouTube focused on trauma-informed, prevention-oriented mental health and emotionally secure parenting. Thank you so much for listening and for being a part of this important conversation.